Hello, everyone. My name is Mari Johnson. I'm the CEO of the Centre for Digital Business, and I'm joining you today from Canberra, Australia. I would like to start by acknowledging the traditional custodians of the land where I'm presenting today, the Ngunnawal people. Greetings, everyone. My perspective and approach is the human experience in complex servicing systems and how the human experience is the most critical determinant in service design. Here we see the impact of health illiteracy and complex bureaucratic health information on service design. In this netherworld, health outcomes are shattered. What I will be sharing today are stories of the human need to understand and to be understood, and how co-designed and embodied systems presents untold humanitarian impact. The human need to understand and to be understood is lost in a 100-year-old industrial paradigm across servicing, education, and health. This paradigm is one of structure, process, mass industrial settings, resource rationing, fixed locations, channels, defined hours, downtime, industrialized, not personalized. All three areas require empathetic conversational engagement, yet are faltering under the unsustainable burden of escalating demand, resource rationing, staff burnout. Notwithstanding the massive investments, this is a failing paradigm. In this structured industrial world, we bear the limits of industrialized health. The first story is about Nadia, the world's first AI-powered digital human for service delivery, co-designed by people with disability. Let's meet Nadia.
This is Nadia, and although she looks like a person, really, she's a computer system that uses the latest technology to help you find the information you want.
The whole concept of Nadia actually came from people with disability, because the current paradigm of having structured websites, of having structured forms, of people with disability having to do things according to the government's requirements, we had to flip that and to say, what does it actually look like from the point of view from the person with disability?
So let's see Nadia in action.
Can make it easier for you and other NDIS users to get the information and help you need.
The avatar learns by all the questions that people will ask and all the answers that it will give. So it continues to learn, it continues to apply patterns, so that in response to questions and interactions, it becomes more and more personalised. We'll say, you know, this is too big, it is too big, ambitious, and in fact it's not. The greatest risk is that we stay where we have been, and for people with disability, that would be an incredible disservice.
This is now the realm of science fiction, and for me, that's outstanding. I'm part of something that is making science fiction become real today, now, right here and now.
I started work on Nadia as a human rights issue well before any of the technology was brought together. The UN Convention on the Rights of Persons with Disability is remarkable drafting. It calls out the right of the freedom of expression and access to information by accepting and facilitating augmentative and alternative communication so that people with disability can receive and impart information and ideas on an equal basis. It seems to me that we haven't got this right. In healthcare and government, many of us are underserved and effectively excluded, not because of our own capabilities, but because the industrialized, rationed model doesn't accommodate the individual and their human rights. Nadia is a phenomenal example of co-design, including with people with intellectual disability, supported by university psychology faculty. Co-design which revealed insights not otherwise discernible, such as the personality. And here we see a coloured crayon drawing itself co-designed by people with disability, of the experience they wanted, a face and a simple conversation. And similar themes in this next story, the AI-powered digital human cardiac coach. This is my husband, Alan, patient number 1, an ex-Royal Australian Air Force aeronautical engineer with a research background in expert systems. Shortly after the Nadia project, Alan underwent his 4th heart surgery. All up, over the past 15 years, 8 cardiac bypass grafts and 4 stents. And notwithstanding our skills and experience, at the beginning of his journey, we were both desperately health illiterate. If we struggled, how could anyone survive physically and mentally? And it struck me that our experience with bureaucratic health information, not understanding it, with no one to talk to when we were most vulnerable, was in many ways the same isolating, traumatizing experience suffered by people with disability. Well, this is a big, big problem because around the world, 18 million people die each year from cardiovascular disease, with 60% of populations health illiterate. People are unable to complete healthcare forms, cannot read basic text and instructions, cannot navigate websites, most with a reading level of grade 5 and below. And yet, healthcare information is still produced at grade 10 level and up to college grade. Like this example of a patient question on the American Heart Association website. This demonstrates the significant challenge of health illiteracy. Patients who are health illiterate asking questions and expert health professionals writing exam answers. You survived the surgery, which is great. Now our communication and your illiteracy will kill you. A great majority of the population simply cannot comprehend this complex information. So very simply, what if we could find a way for people to access and understand cardiac health information and ask questions without fear of judgment or stigma, in simple language, in their own words, at any time? So let's meet the AI-powered digital human cardiac coach. This is not a marketing video, but a real interaction with a real heart patient.
Hi, I'm Al Johnson and I'm patient number 1 for the Cardiac Coach project. I know from personal experience over 4 surgeries that going home from hospital is very traumatic. This conversation with the digital human cardiac coach tries to capture each patient's individual risk factors so that hospital social workers and other experts can help the patient transition to home safely. Thank you.
Hey, Coach.
Hi, Alan. How are you today?
I'm okay, I guess.
You don't sound sure. Is there something I can help you with?
Well, I'm scared to go home from hospital.
Most patients worry about going home. You will not be sent home from hospital unless we believe you are well enough. Make a time to talk to the hospital social worker about your worries. If you can, have your caregiver there so they can hear what the social worker says and help you when you go home.
How will I get home from hospital?
You will be tired and sore when you leave hospital. You are also not allowed to drive until your doctor says so and are not allowed to carry anything. You will need a family member or friend to carry your bags and drive you. If there is no one to do that, tell the hospital social worker so they can help arrange safe transport.
We have a lot of stairs.
The hospital therapist will check that you can climb a few stairs before you leave hospital. You will be tired and sore when you get home, so sleeping downstairs is best. If you can't sleep downstairs, rest on a couch during the day and only use the stairs to go to bed at night.
I've never taken meds before.
The hospital pharmacist will give you enough meds for a few days at home until you can buy more from your pharmacy. They will tell you when to take them and how much, and how to remember them. They will also tell you what to do if you forget to take them. It is very important you take your meds. If you don't, you can become very sick very quickly.
Thanks, Coach.
That's good, Alan. Glad I could help. I'll pass our conversation to the social worker so that they can help you get everything ready to go home. Goodbye.
Back in 2017, not long after his surgery, we wrote this article together. Centralized e-health failed us. We spoke about the need for a digital human cardiac coach, an empathetic conversational system to be with us on our life journey. And over the intervening years, from the unusual combination of our lived experience and professional expertise, we designed and developed the digital human cardiac coach and released all the IP onto GitHub. And the reason why we did this was that as COVID forced the closure of cardiac rehab globally, which is rationing to the extreme, we wanted to do the opposite and hit the accelerator. So releasing all the IP onto GitHub removes a major cost to development that has taken us 15 years and catalyzes an ecosystem. And here's what the digital human cardiac coach is about. Imagine being able to interact with rehab lessons and ask questions over and over again at any time. Imagine lifelong support, not just the 6 weeks of rehab. Why was cardiac rehab ever rationed, or even the need to stop during COVID? So while there is a great deal of interest in the emergence of embodied empathetic systems, the real innovation is in the co-design and the development of the corpus. Nothing happens without this, and everything has a pattern. So from the human experience, there are common themes through the rhythm of the patient journey and patterns of conversation that only co-design can reveal. What are the questions that people ask throughout their life journey? How are these expressed? The Codesign Corpus is a bounded system with deep domain context. It is not a Siri or an Alexa designed to answer questions on any topic from the general population. We have documented thousands of questions and phrases and sampled tens of thousands of utterances from multiple sources over 15 years. The raw questions actual patients and their families ask, and created the concept of guided conversations as a mechanism to literally guide people conversationally using everyday words and idioms, and for these conversations to be able to be repeated as often as the patient needs to build their confidence and their understanding. In AI systems development, there is a focus on the need for large sets of questions and answers. To this we say, this is not enough. What if a patient doesn't know what question to ask, or doesn't even understand or have any knowledge of key concepts such as volume? And this is the case given the extent of health illiteracy across populations. This is common in any service delivery setting. Machine learning cannot learn what the patient doesn't know, or what whole populations do not know or do not talk about. And similarly, machine learning on a large data set from health illiterate populations will have gaps and errors. Crowdsourcing fails with health illiterate populations. And similarly, crowdsourcing also from experts or sophisticated users also fails health illiterate populations. So what we have open sourced published onto GitHub is an extensive repository of corpus content, ready to go priority conversations, design templates and accelerators, and the all-important business case material. I've been doing business cases for a long time now, and I think this is the most exciting. No time to go through this here, but check out GitHub and the video that we have explaining all this. Dr. Chris Hillier, who is now back in the United Kingdom, had been leading the Hannah Digital Human Cardiac Coach project at the New Hanover Regional Medical Center in North Carolina. Explained his thinking on the business case in a public webinar in 2020. But this is not about doing more of the same. So check out the resources. The exponential factor here is that there is no new technology needed, no new discovery we are waiting on. Imagine if there were 1,000 of these helping patients over the next year. And imagine accessing healthcare services in a meta world where the digital human cardiac coach is part of a new world of telehealth for everyone. What the Facebook meta strategy does and the Microsoft meta strategy makes the immersive virtual technology platforms ubiquitous. The cost of entry is reduced, if not eliminated. What will emerge is nothing like the traditional sclerotic world of digital services and telephone telehealth. Thank you, everyone.